Welcome back to DC Today. As you heard those numbers from the CDC, pandemic-wise, we are not out of the woods yet with regards to the coronavirus. But a group in Mississippi is working to head off another deadly wave. I want to show you what they're trying to do. They are trying to match vaccines with patients. Pam Chatman is known as the boss lady in her Mississippi community down there in Cleveland. She's been working with the local governments to get the elderly and the sick people without transportation to both testing and the COVID-19 vaccination sites. Ms. Chatman actually uses her own transportation company to connect others, and she joins us from Cleveland. I like that, the boss lady. So let me ask the boss lady this question. How are things going right now where you are in Mississippi?
Well, we're taking it one day at a time. Since the J&J got pulled off the shelves, we have been a nervous wreck. People are pulling out that we had kind of encouraged to get the vaccination. So right now we're going through some difficult times.
There's a popular misconception that African Americans aren't getting the vaccines in the numbers that they should out of fear of past negligence by the medical industry. What issues are you finding? But you're the person that's out there on the front line. So what issues are you finding in the black community from the people that you're transporting to get their shots?
Well, you know, many people still don't believe that the vaccine is what it is. And then there's the younger generation who just refuses to take it. But we have been trying to find a new way to encourage the different individuals from elderly to young to take the vaccine. And we're doing it by giving them some little things, some little tokens to go and get vaccinated.
Ms. Chatman, you follow the news all over the country. You've got the governor of Michigan saying, please send us more shots. Today's New York Times has a piece that says that Mississippi has 73,000 scheduling shots that need to be filled, but not enough people to fill those slots. First of all, is that what you're seeing on the ground? And secondly, what can be done to increase the number of people who will want to get the vaccine?
Well, one of the things, I think the numbers are not just as accurate as they're saying they are, because we are now currently, as you know, we're doing mobile transportation to drive through pop-up shops for vaccination. And you don't have to register. You just drive up, show your ID, and you get vaccinated. And I think that the numbers are not as big or as people are saying they are, because we're seeing long lines at the pop-up drive-through vaccinations.
You know, last week I was talking to Dr. Reed Tuckson, who's down in Georgia. He was the health commissioner here in Washington. And I was asking him, how closely is the White House listening to broadcasts like this? And he said, believe it or not, they're listening a lot. And I found out last week that they did. The vice president, or actually the president, went over to a vaccination center in Alexandria, Virginia. And it was in a church. And the reason I ask him the question is because everybody forgets that in the black church you have the nurse who watches out for the kids, and if Miss Susie gets sick, there she is standing at the back of the church, and that's how a lot of people are getting their vaccines. Are you getting reimbursed for what you're doing? Because I want to ask the question on your behalf, because you're doing a lot. And are there others out there like you that would be doing exactly what you do if they had the dough?
To answer the first question, no, I'm not getting reimbursed. But we did partner with the Community Foundation of Northwest Mississippi that is taking in donations from all around the country for us to continue with the Vaccination Transportation Initiative. And we're taking the people, we're going to black communities, and we're going to the churches. We're going to meet the people where they are. And so yesterday we were ready with about 400 plus people to get ready to take the J&J. And at 5 a.m. when they found out that it had been halted, everybody pulled out. So we're continuing to talk with people, to educate them and to empower them that it's okay. And, you know, it's important that a lot of the community leaders are stepping up. We're not politicians. We are community leaders, advocates, and we want the people to be vaccinated, but we want to do it in a safe way and make sure that the drugs that we're taking is safe as well.
And I wanted to ask the question so that you didn't have to. So, Mr. President, if you are listening, send some money down to Mississippi, because I guarantee you the boss lady has a lot of other people that she can get to vaccination sites. Pam Chatman, thanks for being with us.
Thank you.